Good afternoon, everyone. I want to welcome you to the Personalized Healthcare and the Future of Medicine session. I'm Madeline Bell, and I'm the President and Chief Executive Officer at the Children's Hospital of Philadelphia. And I'm joined by three very distinguished panelists who are going to talk to us about innovation in the future of healthcare. The first to my left is Anu Achara, who is the Chief Executive Officer of Mapmygenome. Her background is in technology, and she has a master's in physics. Next is Dr. Shashmir Vayala, and he's the founder, chairman, and managing director of VPS Healthcare, and he is trained as a radiologist. And finally, to the left here is Soumitra Dutta, who was the former dean of the S.C. Johnson College of Business at Cornell University. He's an author, an academic, and a businessman. So I have some questions here for the panel. And why don't we give everyone an opportunity for this one, because I think this is a broad question. If you think of healthcare 5 years from now, what do you believe will be different about the way we deliver care? Maybe we'll start with Anu.
Sure. So I think the way healthcare is going to change primarily is going to be in the power of the consumer, because consumers will have a lot more information about themselves, whether it's genomic data or any other kind of data. The second is, I think a lot of technology will come into place, whether it is in the form of using driverless cars or drones and other such things. But I think the most important thing is that the cost of delivering this, people will start to understand that it will be better for themselves to be looking at prevention rather than going to a doctor only when they have a problem.
Dr. Shashmir.
I think 5 years from now, we would move on from a break-fix model to a predict-prevent model, because I think healthcare everywhere is getting more and more expensive. You go into a restaurant, you order a meal, you pay the bill then and there. But in healthcare, you take 6 months to be paid. And systems are getting complex. DRGs, different countries follow different standards. I think standardized care with SOPs built in, which could do the medical arbitraging between countries, and coming up with one standard that could decide the way patient will be at the center of healthcare.
I think health is a domain which really is asking for dramatic change over the next 5 years. Because one thing is very clear is that if we carry on doing business as usual, we will just simply not be able to meet the demands of health from the population of the world, be it in developed economies or in emerging markets. So the need for change is very obvious. And the question, which is a very interesting one for us to ponder, is what is a solution? Is it a question of having more doctors doing more of what they do today, which is one important aspect of solution, but that by itself will not provide the solution. I think a lot of the solution for the change and transformation of digital health or healthcare in general will lie outside the traditional domain of traditional medicine or medicine practitioners. And I think that's where I see a lot of change happening, whether it's digital technologies or genomics, other kinds of hospitality approaches, other kinds of business model changes. I think the changes in the entire system is what I think is going to happen.
And do you think staying with you, do you think there's an industry that will help us, any particular industry that you can look at? You mentioned digital and focus on consumer. Is there a specific industry that we should look to as healthcare providers to learn?
So I think, health is an all-encompassing theme for individuals because it affects the quality of life, it affects what I'm able to do in work and personal life and so on. And I can see at least two distinct industry segments having a tremendous impact on health in the future. One clearly is technology. Just like in automobiles now, the new version of automobiles are being defined by new players, Silicon Valley. I think you will have new entrants, whether it's Amazon or whether it's Alphabet or other kind of tech players entering in the sector and defining sort of new platforms, new models quite actively. The second sector, which I think is interesting for healthcare, really is hospitality. I think health is also about looking after, about service, about caring. And the sector that is probably the most well adapted to it is the one which is hospitality, hotels, other kinds of broad hospitality. So those are two sectors that I think, in my view at least, are very relevant for the future.
So you mentioned genomics, Anu. You are the CEO of Mapmygenome. I'd love for you to talk a little bit about how you see genomics playing a future in healthcare delivery.
Certainly. So I think when you look at what's happened with genomics, the price per sequence has gone down so drastically that tomorrow, I think, in the next few years, we are going to see a whole genome sequence done for $100 or less. So I think the fact that it is going to be that cost effective is going to make it easy for governments and for individuals to be able to get a whole genome sequence. But once they get that, the information that you can get from there is going to be tremendous, whether it is for governments to be able to say what is the kind of load for each disease for my country, whether it is about being able to plan for nutrition for all the citizens, whether it is about being able to say what kind of medicines or medications are going to work for these individuals. So if you're looking at optimizing revenue or optimizing investment in this space, then you're looking at being able to cut down a lot in terms of what insurance is likely to pay for medications. You're likely to look at how nutrition is going to make a considerable change in terms of what you're going to provide as nutrition to each of these individuals. So I think it has its wings in many different areas, and I think the prime differentiators will come when the price point comes down very rapidly, and the fact that people will be aware that something like this can actually have a difference. And as more and more data gets generated, I think we will start to look at medicine becoming much more precise, from being one size fits all to specifically for each one of us, not just in medicine, but also in nutrition, a lot of other things in the way of how we live our lives better.
Dr. Shashmir, I've visited your hospitals, and we've heard a bit about the importance of hospitality. I got to experience that firsthand. Perhaps you could share with the audience some of the things that you've done to invest in hospitality, and you also mentioned prevention of disease. So maybe you could expound on some of the things that you're doing uniquely at your hospitals in those two areas.
So the first thing we want to do is design a hospital which doesn't look like a hospital, which doesn't smell, or even the food, which is different from the general hospitals. We want hospitals to be welcoming, and we want hospital as a place where people would come in, have a cup of coffee, use the Wi-Fi, have meetings, have a good gym. We have a yoga instructor, which is very popular. And we have an auditorium, which convenes health and nutrition programs. So in the hospital, we have a food division, which does healthy food for schools. So we teach the culture of eating in correct quantities, eating in calories, and not to be too much on dieting and making yourself thin. But we talk about nutrition as a whole. So if you have a culture which is inbuilt into the community, especially among the schools, I think we have a system where kids become responsible by themselves. And going to the hospitality side, I think today we are talking about medical tourism. So we have a network of hospitals in UAE, in the GCC, and in India so far. So we are connecting the systems together. We believe in integration. So we have a group of doctors who does bone marrow in India coming to UAE and doing the procedure, because here the problem is volumes. So we connect the dots. We operate on a single platform where we have one patient ID for all the hospitals. And then the data sharing and data mining is very important. So what we are trying to do is, in the next 5 years, we want to progress from a conventional brick-and-mortar hospital into a data company, which has all the vital data, which is more expensive than your credit card. So we want to look at data as the next tool for designing hospitals. We want people to feel that they are at the center. The patients are at the center. And I think the disruption which would happen in healthcare would be around patient. So I think it's a very risk-averse industry. People are very scared to take decisions because it's very sensitive. Anything goes wrong, it's like an airline industry. You cannot make any mistakes. So the tipping point is now. We need to bring that change. We need to make it cost-effective. We need to be accessible to a lot of public as well. So I think the change is on the edge.
Soumitra, I was going to ask you a question. Recently in the United States, Amazon, Berkshire Hathaway, and JP Morgan announced that the three companies are forming together to attack the problem of healthcare costs and to improve the health of their 1.1 million employees. What do you think the role of employers or governments in certain countries will be in charting out the future of healthcare? In the past, it's really been healthcare providers that are innovating. Do you think that the role of employers will change in the future?
I think, people are watching this move by Amazon and JP Morgan Chase and Berkshire, I think, very, very carefully, because certainly Amazon has shown the ability to go and disrupt industries. And I think people don't doubt that there's a lot of data, which Dr. Shashmir mentioned, a lot of processing, a lot of fairly routine, what I would say, non-medical tasks outside the practitioner's office that can be done in a much more simpler and more effective manner. You're raising a very interesting question of what's the role of the government. And I think health has become too big an issue in which the government cannot solve it alone. You're seeing the cracks appear even in the UK with NHS, which traditionally was the model of a government, strong government model. And the need for private intervention is very clear. So I think the government has to partner with the private sector in most cases. Even in the case of Amazon, most likely the government will play a role, at least for a lot of the employees. And I think people are trying to experiment and discover what model works best. So we have to wait and see, but the government role is going to certainly be reduced and will need to be in partnership with the private sector.
Anu, maybe I'll ask you this question. In the United States, a number of children come from all over the world to our hospital, and we're investing heavily in digital health. What way do you think digital will change the future? We heard a little bit about that, but do you think there's something significant that will occur in the future to really change the landscape of healthcare using a digital health platform?
Absolutely. I think, as we start to look at us as not just being, there are elements of things that we can start to understand. And I think when you look at children, a lot of the habits start right at the beginning, right? So you start at whether they are 3 years, 4 years, they go to school, the kind of atmosphere they look at in terms of what they're eating, what they're playing. I think all of that has an effect on the child, not just then, but in the future. So I think once we start to quantify that for each individual, and whether the teacher or the school has access to some of that information in terms of how they prepare the school lunches, for instance, how you would actually look at screening of these children, whether when they are babies, when they are slightly older, I think will have a huge implication, because if we can start to make those changes or those habits right at that point, I think we'll start to see a decline in terms of what is currently becoming an epidemic, whether it's in diabetes or cardiovascular or other such things. So if we can start to inculcate that at the school level, at the employer level also, which is one of the things we are doing at Mapmygenome, where we are saying, it's more important to get a whole group of people excited about the same thing rather than being able to make it an individual thing. So if you make it a drive which says a whole school is involved in saying, can we run or track our activity together, can we track the food we eat, I think it will have a huge impact. It will have a huge impact in the way we look at, how we are treating our whole system or society as one rather than as individual pieces. So you collect all the data, you use AI or whatever to make sure you can predict the right things on what we need to do for these children or employees. So I think there's a huge potential if all we can do is to collect data from all of these individual constituents of any society.
Can I just add on to that? I think in the whole debate about digital health, everyone talks about more data coming together, standardized, harmonized, and available and owned by the patient or customer. That's great. The challenge that I see is, do people actually understand the data? It's the question of, for example, financial literacy. Even today, people don't understand all these options given by banks and everything else. And being a non-medical practitioner, but with some advanced qualifications, I don't actually understand a lot of the jargon, a lot of the data given to me, even a simple blood test. And the question is, how do you educate people to make sense of all this data that will come to them? So that's the question that I see, which is not easily resolved.
I'm so glad you mentioned that, because Anu and I were actually speaking about that before the panel, that the key is really the analytics and interpretation of the data so that you can apply it in medicine. It's where we're investing in our workers, and where I think that's a terrific point about the future of the healthcare worker. On that topic, Shashmir, you employ thousands and thousands of healthcare workers today. Do you believe that there will be an evolution of the people taking care of patients in the future? Do you think that landscape will change?
I think already we have started to see the change, especially Dubai itself has become a heart-safe city. So I think the time from if you happen to have a heart attack at your home, and by the time you reach the hospital, that time is getting shorter and shorter. So you have trained people in the society, somebody in your apartment block who knows to give that first aid. Because till now it's considered as something that cannot be done. But now we have realized that with this increasing traffic, access to hospitals getting difficult, you need to get the access of care as open as possible. So we'll have more health practitioners, more public health experts who would take the role of a lead nurse, or even your smartphone, which could give you that immediate advice or a connect to the doctor or a nurse practitioner, which is going to be the easiest way of getting an advice on that point. So I think we have seen the change. Technology, as Soumitra said, is getting involved, especially Amazon showing its interest. We are all excited. We are talking to technology companies. So now we don't believe in brick and mortar. Already we have started believing us as the Facebook or a Google of healthcare. So I think there's a great potential. Who can crack the code will be the winner. That could be the biggest disruption that we would have seen in healthcare.
So we touched on digital health. We touched on the importance of keeping communities healthy and some of what you're doing, the evolving healthcare worker everywhere from more analytic focus to people who are non-clinical in the home. Is there anything that you all would like to say in the next couple of minutes about the future of healthcare that we haven't touched on yet today?
I think he did mention, for instance, in genomics, I think, adding of genetic counselors and adding that level of, the person who explains to you what this means and what you need to do to make it more actionable, I think is definitely something that we strongly believe that is key to making all of this much more pervasive across the board. Otherwise, I think data is data, but if that data can become real value to you, it'll be great. The second thing is if we can get our movies or one of the big mass media houses to be able to ensure that we can spread the message, I think then it becomes a lot more effective than how much ever medical knowledge we might give out.
Well, maybe I'm not a medical doctor by education, but my family, everyone else in my family is really, or at least nearly everyone else is a medical doctor. I grew up in a family with medical doctors. And I think one important thing is the behavior of medical doctors has to evolve. Medical doctors are a function of the education they get. The education is very technical. It is very, focused on what they're supposed to be doing. And today the world of health has become so much broader. I think, Dr. Shashmir, you're a good example of someone who successfully migrated from core medicine to a business leader. I think not everyone can be like you, but at least you need that kind of thinking to have a broader perspective. You need that kind of humility to accept that you don't know it best. I have seen my own father, who's a senior doctor, react sometimes in a strange way when his patients question his diagnosis. He just doesn't expect that to be the reaction. So I think a lot of interesting behaviors and a broader perspective for which I think the education in the medical schools has to change. That's my one point.
Very great point. Dr. Shashmir.
I think I wouldn't agree more with you on that particular issue were doctors. Even in our hospitals, we provide free second opinions. So we believe that patient is at the center, and holistic medicine is what we require. We need patients to be responsible, and I think public in the future, public health space should be regulating, and more public-private partnerships should come into the limelight to reduce the cost and make healthcare more efficient and accessible.
Well, I'd like to thank our distinguished panelists. We're out of time. We covered a lot of territory, so please give them a hand for their input.